How are you doing in there? My name is Dr. Cozy, and I am here to assess your neurological and cognitive state while you're in the hyperbaric chamber. Since you were exhibiting some signs of confusion and an aura when we first admitted you, we need to do some follow-up assessment while we are giving you your oxygen therapy just to make sure that you're stable, okay? And even when you exit the chamber, we will be continuing to repeatedly test you throughout your visit here. So, just a moment. Are you currently having any dizziness? How about confusion? Do you still have an aura? Are you seeing lights in your vision? Are those present even when you close your eyes? Any headache? How about any nausea? Is it to the point where you feel like you might need to vomit? If it gets to that point, let us know, right? There should be a button located in the inner wall that you can push that will call an attendant. Okay. And can you tell me on a scale of 1 to 10 what your current pain level is? Okay. Is that in any particular area of the body? Is that everywhere? Okay. And can you describe it for me? Is it dull, sharp, throbbing, radiating anywhere? Okay. Okay. Can you come a little bit closer to the glass, please? Thank you. Just going to get a look at your skin color here. Make sure there's no bluish tinge, any kind of redness or streaking. Okay. May I have you look up? Okay. And can you close your eyes for me for a moment? Okay, you may open them. So again, can you come closer to the glass, please? Thank you. Alright. I'd like you to try to keep your eyes open as best as you can. Focus your gaze right here between my eyebrows. Are you experiencing any sort of irritation, any strain, pain, or other discomfort from the use of my light? Okay. Now I'm going to do a couple more tests here using it. I want you to keep your head completely still, so don't move it, and just try to follow my light only using your eyes. Doing great. And again, any sensation of strain, pain, or discomfort? Okay. Can you tell me which one is closer to you? My light or my finger? Okay. Light or finger? Light or finger? Light or finger? Good. I'd like you to focus on this finger, okay? Looking only at this finger. Out of your peripheral vision, I'd like you to tell me how many fingers you see me hold up. Right? Now we're going to switch sides. So look only at this finger now. Good. Okay. So now I'm going to be tapping on the glass on either side. You're not going to be able to see my fingers, but you will hear the taps. And I would like you to let me know which side that you hear me tapping on, okay? Okay. Good. All right. Pass with flying colors. So now we're going to do some olfactory testing, which means we're going to be testing your sense of smell, okay? So my computer is going to open a couple of valves inside of the chamber, and I would like you to tell me what you smell, okay? None of them will be foul or distasteful, promise. So. Yes. Good. Yes, lemon, okay. That one's a bit more complicated, but yes, freshly cut grass, that's correct. One more. It's clove. Good job. Okay. So you passed. All right. So we're going to pause on the neurological testing for just a moment, okay? I'm going to go through a series of cognitive tests that will be increasingly difficult. But due to the fact that you were deprived of oxygen for a long duration, we need to make sure that everything is intact. So, on this piece of paper, are you able to see? Good, okay. So you'll see that there are 6 different animals. Can you tell me what that is? And here? Here? And this one? That? And now this is a very simplified image, but are you able to recognize what it's meant to be? So then, can you describe for me where the number 6 should go? Okay, and how about the number 2? Good. The number 9. Alright, and how about the number 4? Now, this being the minute hand and the hour hand, where would each need to go or point in order for it to say 9:15? Okay, very good. Now these are going to get a little more complicated. So, as you'll see, there is a pattern established in these 6 squares. Out of the 5 listed on the bottom, can you tell me the corresponding letter to the one that would fill in that square there? Good, okay. Alright, same concept. We have established our pattern with these 4 squares. However, this one is empty. Which of these will belong there? Good. Alright, again, I'd like you to tell me which letter belongs in that vacant box. Same thing. Which one fills in there? It's definitely a bit trickier, isn't it? Take your time. Which one of these fills in here? And we have one last one. So, which of these goes here to complete the pattern? Well done. Okay. on this page, there is a number. Are you able to see and identify for me what number is on the page? Good. How about on this page and this side? Good. Now on this one and here. That one and here. Good. Are you able to hear that tone? I want you to tell me which side you hear it on. Good. Good. So I've marked this tongue depressor with some little increments here, okay? It's going to be our makeshift ruler. So I want you to tell me, is point A closer to you than point B? How about point A, point B? Point A, point B? Point A, point B? And point B, point A? Point B, point A? And point A, point B? Good. Alright. So now, is my light brighter here or here? How about here or here? Sorry, let me do that again. Here, here. Okay. Is it brighter here or here? How about here or here? Is this the same color here as it is there? Okay. How about here as here? Is this the same color as here? And how about here versus there? Is this the same color as that? Is this as bright as that? How about this? The same as that? Don't know what that was. Is this the same as that? How about this and this? And this and that? Good. Okay. So, how are you feeling now after going through that testing with me? Are you feeling any kind of strain, pain, or discomfort? Is that the same level that you were feeling before? Okay. And how was your nausea? Is it diminished? Is it the same? Or is it increased? Okay. So, one more thing really quickly. So I'd like you to come closer to the glass again, if that's okay. And I'm going to examine your skin one more time, this time using my light so that way I'm able to see very clearly if there's any sign of cyanosis, which would be that bluish tint to the skin due to decreased oxygen, any kind of redness, any kind of yellowing, which we definitely don't want to see, okay? Okay, so just scoot close to me. If the light is too bright at all, go ahead and close your eyes, okay? It's really important that we keep track here. Can I get you to turn your head to the side? You can pick a side. The other side. Okay. Tilt your head down for me so I can see your hairline and your scalp. Good. And now if you can look up so I can see the underside of your chin. Good. Okay. And then lean back just a little. I'd like to take a look at your neck. Right? You can relax. And actually, one more thing. I lied, sorry. Come back. Just need to check your eyes one more time. So do your best to keep them open. Direct your gaze right here in between my eyebrows. Good. Now you can relax. Your levels are continuing to increase. Your oxygen is actually at a normal level now at 98. I am going to keep you in the hyperbaric chamber for 1 more hour, okay? At the end of the hour, we will come in and remove you. We will do another thorough comprehensive exam of your cognition as well as your neurological function, and a physical exam as well. So we will be checking your skin physically using gloves, of course, and listening to your heart rate, your lungs, your digestion, etc. We will do some sensation testing at that time as well, because having severe oxygen deprivation for a prolonged period of time can have all kinds of effects on the body. So we need to make sure that we don't miss anything. And sometimes things can have a delayed effect. It doesn't always present right away. So we will be keeping you here overnight, and we will adjust our plan on a day-by-day basis depending on how well you recover. Okay? I don't have any more information in terms of a plan at this point. We will, I think, re-examine after we take you out of the chamber and conduct our thorough assessment. And at that point, depending on whether or not you stay stable, and after a period of time under observation, then we can talk and make a decision about next steps. Okay? Okay. Do you have any questions for me? Okay. There is a call button located inside of the chamber that you are welcome to use, particularly if you do start feeling extremely nauseated, like you might need to, go ahead and press that button, and a nurse or other medical attendant will come in and assist you. Okay? Okay. And same goes for if you need anything else. Okay. So I'm going to go discuss our examination with my team, and someone will be back in here to check on you before the time is up. I'll come back in here in an hour when it's time to take you out. Okay? Okay. See you in a bit.